I'm going to let everyone in now. Welcome, everyone. We're going to give just a couple of minutes for late people to arrive, but we'll start in within a minute or two, and others who are coming can join. Okay, so let's go ahead and get started so that we can end on time and make the best use of our time. Thank you for joining us today. I'm Katrina Gay. I'm the Executive Director of NAMI Tennessee, and it is my deep pleasure to welcome our guest presenter today, Dr. Beth Baxter. I will let her do a little introductions. You all have seen it because you've registered. She is a psychiatrist. She is a peer. She is a dear friend. She's a NAMI leader. She serves on the board of NAMI Sumner Wilson. I've known Beth for, gosh, maybe 30 years, close to that. And it has been a wonderful friendship. And I have deep, deep respect and appreciation for her and gratitude for her spending her time today to speak to us about schizophrenia. Today is World Schizophrenia Awareness Day, I think it is. I'm trying to remember the actual language. So we're just, as part of our commitment to ongoing education, we are delighted to have Beth with us to talk more about the latest in schizophrenia and research and treatments and what helps and all the good things to keep us all informed. So I will turn it over to Beth, and let her take it from here. Thank you.
Okay. My name is Beth Baxter, as Katrina introduced me. I'm going to talk today about schizophrenia, its symptoms, and the treatments that are available to bring hope of recovery to many who have it. I hope that you can use this information to help yourself or a loved one with this illness. Schizophrenia affects about 2.8 million adults in the US. People are typically diagnosed with schizophrenia in their late teens to early 20s. Women generally experience symptoms later than men. Schizophrenia is a very disabling illness and affects a person's social relationships and how effectively and productively they can work. Schizophrenia is a psychotic disorder. There are other psychotic disorders that share many of the same symptoms, such as schizoaffective disorder. Some of our discussion about schizophrenia today can apply to a broader spectrum of psychotic illnesses. There are 4 forms of symptoms of schizophrenia. The first are positive symptoms, which are added experiences that your brain creates, like delusions or auditory and visual hallucinations. The second are negative symptoms, which are like missing pieces of your usual self, such as decreased speech and decreased interest and motivation in the world around you. The next set are cognitive symptoms. They affect how you think and process information. They include attention, memory, and social functioning. The fourth set include disorganized thinking and motor behaviors. Disorganized thinking is typically inferred from a person's speech. They may switch from one topic to another that's unrelated. Disordered motor behavior can range anywhere from unpredictable agitation to catatonia, which is an absence of motor behavior. We'll be talking mainly today about positive and negative symptoms. It has been discovered that the brains of people with schizophrenia have less gray matter, which is the outside layer of the brain responsible for cognition. In addition, people with schizophrenia have bigger ventricles or naturally occurring holes in their brain. We still don't understand how positive, negative, cognitive, and disorganized symptoms of schizophrenia occur in the brains of those affected. Hopefully, we will understand this better as we come to understand the treatments that reduce these symptoms. People with schizophrenia typically have a reduction in life expectancy of 15 to 20 years, meaning that they die 15 to 20 years before unaffected people generally die. This is mostly due to diseases of the heart, blood vessels, suicide, lung cancer, and lung diseases, infectious diseases, and side effects of antipsychotics used to treat schizophrenia. As I talk today about antipsychotic medications, for simplicity, I'm going to be using the trade names and not the generic names of the medication. The first group of medications that are available to treat schizophrenia are called first-generation antipsychotics. These include medications like Haldol, Navaine, Thorazine, and Stelazine. These meds have a lot of side effects, including weight gain, but especially movement disorders. Movement disorders can be reversible, like what we call extrapyramidal syndromes, or they can be irreversible, like tardive dyskinesia. These medications only treat positive symptoms and not negative symptoms. In fact, the first generation antipsychotics can make a person seem more lethargic or dulled emotionally, which is similar to negative symptoms of schizophrenia that we talked about. The use of the term overmedicated can apply to how some people appear when they are taking this type of antipsychotic medication. The next group of antipsychotics that have been developed are called second generation antipsychotics, and they include Risperdal, Geodon, Abilify, Seroquel, Zyprexa, Clozaril, and Invega. They have the potential for reducing the positive and negative symptoms of schizophrenia even more than the first generation ones do. However, they still bring with them the potential for disabling movement disorders, like the first generation ones do, but even more weight gain. The next and most recent generation of antipsychotics have the potential for fewer side effects and better reduction of positive and negative symptoms. These include Latuda, Rexulti, Vraylar, and Caplyta. They do not cause the same degree of weight gain or movement disorders that the first and second generation do. All of the medications in this group, except for Latuda, are available only in the brand form and not in a generic form, which means that they're more expensive. Insurance companies may cover some of these medications. In addition, there are usually discount cards available that would make it more financially appropriate if you have private insurance. It is possible to get these medications free from patient assistance programs offered by the manufacturers if you qualify financially. All three of these groups of antipsychotic medications work on the dopamine neurotransmitter system. About 20 or 30% of people with schizophrenia and related disorders are drug refractory, which we also describe as treatment resistant, meaning that they have failed at least 2 trials of antipsychotic medications. People with drug refractory psychosis have even worse health outcomes than people with psychosis who respond to typical medications. The only antipsychotic medication that is FDA approved for drug refractory psychosis and schizophrenia is Clozaril. Its use can be life-saving. It has saved my life. It can reduce positive and negative symptoms of schizophrenia, and it can greatly improve a person's social and occupational functioning. However, there are times when a person's symptoms of this illness do not respond to Clozaril, and there are times when people who use it cannot tolerate its side effects. One of the potentially severe side effects is agranulocytosis, which is a condition where a person's bone marrow stops producing white blood cells. This is very dangerous because without white blood cells, a person's body cannot fight infections. For this reason, a person who takes Clozaril must have frequent and regular blood tests to screen for this disorder. More commonly, however, people with schizophrenia who take Clozaril develop what is known as the metabolic syndrome. The symptoms of this condition include heart disease, obesity, and diabetes. Other antipsychotics can cause the metabolic syndrome, but it is generally more severe in people who take Clozaril. Heart disease, diabetes, and obesity cause people with schizophrenia who take Clozaril to die much earlier than others in the general population, or even earlier than those who take most other antipsychotics. Despite these serious side effects, there are no other alternatives than Clozaril to alleviate the condition of treatment-resistant schizophrenia. Clozaril is also widely used in people with schizoaffective disorder and severe bipolar disorder who do not respond to other antipsychotics. As I said previously, all of the commonly used antipsychotics up to now work on the dopamine neurotransmitter system. However, clinical research has begun to understand and identify antipsychotic medicines that work through other neurotransmitter pathways. A medication known by the name of Cobenfy works through the muscarinic pathway, and it has been found to be effective for the treatment of schizophrenia. This is the first antipsychotic with a new mechanism of action since the 1950s. It has been found to effectively reduce positive and negative symptoms of schizophrenia. It has a very different side effect profile that does not include the metabolic syndrome. Its most common side effects include nausea, vomiting, diarrhea, and/or constipation. The part of the medication that is responsible for its psychiatric effects is called xanomeline. It stimulates muscarinic receptors in the brain and in the body. It is paired with another drug called trospium in the same medication that blocks most of the action of muscarinic receptors in the body. These muscarinic receptors cause GI symptoms, so trospium reduces most of them in the body. People who take Cobenfy may need to take other medications such as Zofran to further reduce the GI side effects. These side effects usually resolve within 2 to 4 weeks of taking Cobenfy. Cobenfy has been on the market now for the past year and a half. We are still learning how best to use it, both in persons on other antipsychotics and in persons who have yet not taken antipsychotic medication. It is certain that we will continue to learn more about how to use this therapeutic option. Clinical research is discovering similar mechanisms working on this muscarinic pathway that can be given once daily and also in a long-acting injectable form. Long-acting injectable forms of antipsychotic medication have some advantages over oral agents for the treatment of schizophrenia. Some people won't reliably take pills every day. The long-acting form improves a person's compliance with antipsychotic treatment, thereby minimizing the duration of untreated psychotic symptoms. These long-acting forms are associated with lower rates of hospitalization and relapse, and are associated with a 33% lower mortality rate than their equivalent oral forms. Experts say that people with first episode psychosis or early stage schizophrenia may benefit the most from long acting injectable forms. In general, people do not respond as well to antipsychotic therapy after they have had a relapse. Early use of long-acting injectable forms may increase treatment response, prevent relapse, and reduce structural neurologic changes that occur in persons with psychotic illnesses. The earlier the treatment of psychotic illnesses, the better the long-term clinical outcome will be. There are 2 first-generation antipsychotics and 4 second-generation antipsychotics available in the long-acting injectable form. The first-generation antipsychotics are called Prolixin and Haldol, and the second-generation antipsychotics are Risperdal, Invega, Abilify, and Zyprexa. Invega and Risperdal are the most frequently used forms, and they are chemically related. Invega is a metabolite or breakdown product of Risperdal. The Invega forms are called Invega Sustenna and Trenza. These are used the most because they can be given every month, while the Risperdal form, called Risperdal Consta, is given every 2 weeks. The less often that meds can be given, the most likely it is that a person will actually be compliant with the prescribed medication, and the less likely it will be that relapse and hospitalization may occur. There is also a long-acting form of another second-generation antipsychotic called Abilify. While it has fewer side effects than the forms of Risperdal and Invega, it's considered less reliable in treating psychotic symptoms of schizophrenia. In general, long-acting injectable forms of the second-generation antipsychotics have more potential side effects of the metabolic syndrome, just like their oral forms do. A long-acting form of the first-generation antipsychotic, Haldol, also called Haldol decanoate, is sometimes used. Haldol decanoate typically causes more side effects of movement disorder, but less side effects of weight gain compared with the other long-acting injectable forms. While Haldol decanoate is less expensive, it is also harder to use and more uncomfortable for the patient than the other long-acting injectable forms are. One major disadvantage of using long-acting injectable forms is their cost. They are fairly expensive, and insurance companies often won't pay for them the way that they do oral forms. Also, persons receiving these medications have to have a reliable person or healthcare provider to give these injections. This healthcare provider can be someone at your primary care doctor's office or possibly at a walk-in clinic. The plan for how people will receive these injections needs to be planned out and established at the same time the medication is prescribed. Another disadvantage is that some patients refuse any form of injection in general. We have been discovering ways of reducing the burden of psychotic symptoms for people with schizophrenia using treatments other than medications. For example, it has been shown that physical and mental exercise can help to reduce cognitive symptoms. This is very important to recognize, as all antipsychotic medications have been found to only reduce positive and negative symptoms. Cognitive symptoms include attention, working memory, social cognition, and functioning in social relationships. It has been further shown that exercise can possibly reverse the symptoms of cognitive impairment. Exercise can also reduce the effect of the metabolic syndrome that often comes with many effective antipsychotic treatments, if we have talked about this. This syndrome can be minimized also by the use of nutritional counseling and recently popular GLP-1 medications. More work needs to be done to find ways to impact the metabolic syndrome, which takes years off the life expectancy of people who are given a new life by clozaril and other antipsychotic medicines. There are more types of treatment that focus on the psychological, social, and vocational needs of the persons with schizophrenia. For example, CBT psychosis is a type of cognitive behavioral therapy that addresses the psychological aspects and needs of people with schizophrenia. In general, CBT addresses the fact of how we think about a situation affecting how we feel and how we behave. Using CBT, we identify, evaluate, and reframe distorted or untrue beliefs. Distorted beliefs are at the core of many psychiatric disorders. For example, depression involves distorted beliefs about self-worth. Anorexia nervosa involves distorted beliefs about body image. Panic disorder involves distorted beliefs about physical safety. CBT techniques are then successful at addressing disordered beliefs in these disorders, and they may be also successful in recovering from positive and negative symptoms of psychotic disorders. For example, psychotic delusions are positive symptoms that involve distorted beliefs about what is real in the face of contrary evidence. They are distorted beliefs that are thought to be an external threat to one's safety, but they are actually misinterpreted internal events. Auditory hallucinations are also positive symptoms that can be addressed by CBT techniques. Auditory hallucinations are mental events inside a person that are attributed to occurring outside the person. Therefore, auditory hallucinations are also distorted beliefs. In order to look at negative symptoms of schizophrenia with CBT techniques, we need to determine factors that could contribute to these observed symptoms. These include social isolation, trauma, or social anxiety. We need to understand distorted beliefs that are central to negative symptoms, such as the critical self-belief, I will fail. These distortions also include this critical self-belief, such as nothing I do will ever make a difference. Identifying these distortions is the first step in recognizing that they are not true and using CBT techniques for these symptoms. Another form of psychotherapy that is effective is psychoeducation. This involves educating family members and people with schizophrenia about mental illness and empowering them with this information. There are also treatments that focus on the social and vocational needs of persons with schizophrenia. Some are a set of programs called psychosocial rehabilitation. These programs help people with serious and persistent mental illnesses to achieve their highest potential in daily living. They provide a holistic approach to address the needs of the whole person who is affected. These services provide help for persons to improve the quality of their lives, achieve their highest level of functioning and independence, and promote integration into society. By meeting these needs, psychosocial rehabilitation empowers people to lead fulfilling lives and promote their overall well-being. Direct effects of these services include a reduction in hospitalization rates and an improvement in social skills, vocational capabilities, and the overall quality of their life. Components and types of services in psychosocial rehabilitation include an individual assessment into strengths and needs, skill development, which includes daily living skills, social skills, and vocational abilities, peer support, and family involvement. Services also include community integration, therapeutic interventions to address the symptoms of their mental illness, and an empowerment of individuals to understand and assert their rights within mental health and public societal contexts. Psychosocial rehabilitation can be helpful for persons with problems other than schizophrenia who may have many other types of social and occupational disabilities that affect their daily functioning and quality of life. These include persons with developmental disabilities, veterans and trauma survivors, people with substance abuse challenges, elderly individuals, and youth with behavioral disorders. General techniques and interventions used in psychosocial rehabilitation include the cognitive behavioral therapy and psychoeducational programs, which we have previously discussed, social skills training, vocational rehabilitation, peer support programs, and mindfulness, which has been especially effective. There are similar programs specifically tailored to meet the needs of persons with serious and persistent mental illnesses, including schizophrenia. One of these programs here in Nashville is called BrightQuest. It provides psychiatric medication and medical services, in addition to other psychological and social services that are part of most psychosocial rehabilitation programs. BrightQuest especially focuses on creating a community for people to belong to while they are recovering. Persons treated at BrightQuest recover with each other, providing support socially, which is an essential element of recovery for persons with schizophrenia. Other psychosocial programs that are available include vocational rehabilitation, which has supported entry into employment, and dual treatment programs for people with co-occurring substance abuse disorders and mental illnesses. The need for these programs is greater than their availability, largely due to underfunding issues. A word to families of persons with schizophrenia: don't do it alone. It is important for you to have hope for yourself and for your affected loved ones so that they will have hope for themselves. But you must get that hope from others who have been down the same road before you. By informing yourself and involving yourself in educational and support programs available to you through NAMI, you will have that hope for yourself and for your loved one with schizophrenia. It is a marathon and not a sprint. I hope that this information can empower you as caregivers to participate in the care of your loved one. We are discovering new medications for the treatment of schizophrenia that act on new neurotransmitter pathways, such as Cobenfy. This means that there is hope for more effective treatments for schizophrenia that avoid the common side effects of the metabolic syndrome and other disabling effects like tardive dyskinesia we've talked about. And we are discovering ways to avoid common side effects such as the metabolic syndrome with use of GLP-1 medications, nutritional counseling, and exercise. Experts in the field of schizophrenia say that recovery rates from this illness will be higher when clozaril and long-acting injectable antipsychotics are used sooner rather than later for persons experiencing their first psychotic episode. Effective treatment programs such as BrightQuest address the biopsychosocial needs that people with schizophrenia have. These programs treat the whole person affected by this illness. The advances in treatment and services expand the array of options that are available for persons with schizophrenia. More options offer us hope that people will be better able to recover from schizophrenia. Our goal should be that schizophrenia is no longer an illness with a predictable negative outcome. The stigma of mental illness in general has been improving in the 21st century. Mental illness has been reconceptualized as an illness of the brain and not a deficiency of the person. The social stigma associated with schizophrenia is often greater than most other mental illnesses. By improving the chances of recovery from schizophrenia, its stigma will hopefully decline further. Hope is an essential element and a requirement for recovery from mental illness. Hope is also infectious. Where hope goes, recovery will follow. Recent advances in the field of schizophrenia treatment address all of the disabilities that come with this illness and offer hope that people can recover from mental illness biologically, psychologically, and socially. The possibility of hope needs to begin with healthcare providers and family members of persons affected, and from there to the people experiencing schizophrenia themselves. And as people have hope for their own recovery from schizophrenia, amazing things can happen. Let us embrace these amazing possibilities. It has been my pleasure to talk to you today about schizophrenia, and I hope that you can use this information to help somebody you know recover from this illness. Thank you.
Thank you, Beth. That was great. Y'all, you can either unmute and we can take questions, or you can use the chat. And I'll just read what's coming into the chat. We have a question, Beth. What is your best advice for families who have a loved one with the diagnosis of schizophrenia?
My best advice is to be very active in NAMI. And that activity in NAMI means educating yourself about mental illness and providing support for you as you're going through this process, because people who have helped people recover from schizophrenia, meaning their family members, are going to be models for you as new family members experiencing this. So family members of people who have been treated and responded well in the past will give you hope that you can recover too, and that your loved one will recover.
Thank you. John, how are you?
Good. How are you, Katrina?
Good. Good to see you.
Beth, I had a question about what are the essential differences between the second and third generation antipsychotics?
Okay. Well, the new generation is not typically called the third generation, but it is the third generation. And the big difference is that they don't affect the metabolic syndrome as much as the second generation ones do. They hopefully have less movement disorders, but there is still the possibility of tardive dyskinesia in the third group of antipsychotics. But like I said, the main difference is hopefully they treat positive and negative symptoms better, and they don't have the metabolic syndrome as much as the second ones do.
Great. Thank you.
Good. So we have a couple more questions. One is gene site testing crucial to recovery?
Gene site testing is very helpful because it will identify how your body metabolizes medications. And the way your body metabolizes medications usually means which ones will be most effective. The answer is when you get a gene site test, you'll get a group of in the green category, which is most helpful, probably the yellow category, which means some yes and some no in terms of the metabolism, and the red category, which means your body does not metabolize them well. Generally, the ones in the green category are the best to use because, like I said, they're metabolized better by your body. But often we can use the ones in the middle category by increasing or decreasing the dose of medicine that's used. Like sometimes your body will metabolize one faster than another, and so changes in dose can be a help for that too.
Wonderful. Thank you. A couple of comments. Dr. Baxter, I was the program director of Bridges, Kentucky 25 years ago. And I just wanted to say that I am grateful for you for your dedication to self-advocacy and recovery. That's from Tammy Bricado. That rings a bell. Brenda wanted to know if we can use the recording of this presentation on our pages to share with our families of those affected. I don't think we talked about keeping a copy of I know we're recording it, so we'll talk with Beth about this and make sure that she's fine with us sharing the video of the actual webinar. And we'll circle back to all of our affiliates. So thank you, Brenda, for that. And then someone says, thank you so much, Dr. Baxter. You give so much hope to so many. Susan P. And then Mary and Tom said, our daughter has anosognosia, so is resistant to getting care that she needs. I can't quite read it. It looks like she needs to get an injection, maybe. Do you want to say more, Mary or
Can
Tom?
you repeat that question?
I'm trying to read it, and it's hard for me to. I think I don't know if they're asking if she needs to get an injection, but she's resistant to getting care. She has anosognosia, which my short-term definition is lack of insight. It's just sort of part of how the brain has a function and is for many a co-occurring condition with psychotic disorders often. And I don't know that they're asking or maybe talking about maybe.
I
Go ahead.
didn't get a chance to finish it. Yeah, she is um, doing much better than she has. She hasn't been hospitalized for a while, but she is fairly stable on the injectable of Invega. Um, she would like not to be on it because she doesn't think she's ill, and that presents a very large problem. And you didn't address that. Do you see that very often? And
Yep.
any suggestions as far as helping her get insight? She also has borderline, so she has emotional ups and downs quite frequently. But like I said, she spent a couple years at BrightQuest, so we can highly recommend it. Um, Anyway, I didn't know if you had any comments just even about that situation with lack of insight.
Well, that's a good question because lack of insight is something that a lot of people have problems with. Um, lack of insight involves the defense mechanism of denial, and that is something that people with mental illness use across the board. And so, lack of insight into mental illnesses is something that every almost every mental illness involves. It can involve substance abuse and people not realizing they think they have a problem with that when everybody around them feels that they do. You know, depression, lots of other diagnoses involve people having a lack of insight into their illness. And a person is most how that changes. A person needs to be involved in education and into understanding how their experience is different than others. Meaning, for example, how to understand the problems that they're having and know that other people don't have the exact same problems.
Thank you. Another question is if a person has had gene testing in the past, should it be repeated as new medications are prescribed?
Well, yeah, the answer is yes on that. They should be repeated because each of the medications in the gene site testing is put in one category or another. So as we have new medications, we have to decide what category those new ones go into.
Interesting. I think that's all I have right now in the chat. Does anybody want to go off? Oh, here's another one. Here, a couple of comments. Coralie says, so good to see your face and hear your voice today. Still grateful for the time and support you gave me as a new provider. Thank you for continuing to do all you do. And then Brenda is saying, are programs like BrightQuest available for the uninsured?
That's a good question. I'm not sure. I'm not sure how insurance companies cover that or not. You might want to identify somebody at Brightquist to ask them exactly that question.
Yeah, we experienced that it was pretty costly, and did not accept insurance. That was a couple years ago. They might have changed since then.
Yeah, I would think if they did change, it would have been the recent past that,
Right.
yeah.
Thank you. Other questions or comments? This has been great. It's just so great to hear, and you did such a great job of bringing everybody up to speed, including me. And I really appreciate learning always, but this was so good to hear from you. You're such an expert and such a great presenter. We really appreciate it. So thank you on behalf of NAMI Tennessee and our entire community and everyone here. If nobody has any other comments or questions, we will let y'all go with a nod of gratitude and appreciation.